Welcome to Live with Hillsdale Hospital today, Wednesday, February 12th. My goodness, Seth, time flies, doesn't it?
2025 is coming at us fast.
Absolutely. A couple more days and it's going to be Easter. Is that the holiday? Oh, no, it's Valentine's Day. That's right. All right. And we're here to keep all of you informed of what's happening right here in Hillsdale County as it relates to your healthcare needs, issues that we're going to tackle today. Many issues, Seth, that we have to talk about. First, we're going to talk a little bit about the concerns that are coming out of the clinics, the ER, the hospitals. It relates to significant uptick in flu, COVID, RSV, but we'll talk about that in just a moment. So without further ado, it is my pleasure to introduce, you've been here numerous times.
Yes.
But it's great to have you back. Seth Gibson's practice administrator for us here at Hillsdale Hospital. I call you all kinds of titles, I know that, but at the end of the day, your number one job is to make sure that all of our clinics, primary care, specialty care, are functioning on a day-to-day basis. You have enough providers, staff, and that patients are well served. So welcome to Facebook Live, or as we call it now, Live. It's great to have you with us. And Seth, just for our audience, share a little bit about your background. You know, you come from Big Health. You bring that perspective to our hospital, but talk about your background, your education, if you would.
Sure. Thanks for having me on, JJ. I've been with the team here at Hillsdale Hospital for 5.5 years now. So time has certainly flown by.
Yes.
My background, I did come from Big Health, as JJ had mentioned, out of the Northeast Indiana market. Wouldn't trade, working here for anything. Working at Hillsdale Hospital, really enjoy the aspects of working for rural health, really seeing and meeting the needs of our patients in our community.
So Seth, right now, I know this wasn't going to be part of our discussion today, but I think given what we're facing in the last few days, we really have to talk about the rise in the number of patients that we're seeing in the clinic. And we're also, we're experiencing that in the emergency department as well. And our ER manager, Val Hepker, has asked me to remind the community, first call your primary care physician. Now, your primary care is not going to be open at 3 a.m. when you are shortness of breath, and get into the ER. Absolutely not a question there. Flu-like symptoms, those type of issues or concerns. You have access points. Let's talk about that before we get into each of the clinics. But primary care, I'm not feeling well. I have choices, right, today that I can get in to see somebody. Explain to our community what's available.
Absolutely. Our first step when we're feeling ill is to call our primary care office and check on whether there's a same-day appointment or not. We want to reserve the true emergencies for the emergency room. So you're feeling ill, you're not feeling well, please touch base with your primary care family medicine office. And as a backup to that, if you called, let's say, later in the day, late afternoon, and there's not an available appointment at that time, we do have the walk-in clinic at Hillsdale Health and Wellness. So the hours for the walk-in services are 10 a to 6 p, and we're more than glad to work you in. And that is our buffer of sorts, to keep individuals out of the emergency room that don't need to be there, and also make sure that they have access to the care that they need.
Yeah, let's talk. So access to care, let's talk a little bit about that today. I want you to explain to our viewers, there's times, conversations about, I can't get in to see primary care, Seth. We've heard that before. So we beef up primary care. We hire various providers, medical doctors, DOs, APPs, physician's assistants, or nurse practitioners. So let's talk a little bit about access, because you have many access points beyond just a wellness visit or I'm not feeling good today, to establish a relationship with primary care. We call that PCP, right? Primary care provider. And the PCPs first talk to us a little bit about, you don't have to go see a medical doctor. We have a different model that we use here as well, which is very popular. Explain that to our listeners, what that model is, and then we'll get into the specific clinics.
Sure. Yeah, at our 5 primary care locations, we do have a variety of physicians with varying backgrounds with their approach to how they care for patients. But we also have many advanced practice providers, as JJ had mentioned, physician's assistants, nurse practitioners. They really are the glue holding our community access together for care. It's very important that we have a robust roster of advanced practice practitioners to help support not only our patients, but also the physicians as we make sure that we have available appointments for our community.
So let's start with some of the misnomers, misinformation that may be present. Hillsdale Hospital cannot make appointments or serve patients that we're currently serving when someone leaves a practice. True or false?
False.
Okay. We have access points.
Absolutely.
We have providers. and it should be seamless, right? So let's first start with the last clinic that we brought on into our system, Hillsdale Medical Associates, HMA, as they're called. Why don't you take us through a little bit of a journey of who's there, what types of patients are they seeing, are there available appointments, how do we continue seeing a patient, a provider when a provider leaves?
Sure. Yeah, I think I'll start at the end. And if you have been connected with a provider that is a departure, moving on to a different opportunity, then we do have, as we mentioned, 5 practice locations where we'll be able to work you in and meet your needs. So ideally, if you were at a given location, we will see what's available under the roof of that location. And if not, we'll make sure you're connected at one of the other 4 locations outside of that. So currently, Hillsdale Medical Associates with 2 locations. At Hudson Road, we have Dr. McCants, Dr. Baker, Patricia Weiss, and Brandon Douglas. Brandon Douglas will be starting with us next week. We're very excited to bring him on. Patricia Weiss, she goes by Patty. She's been with us since December, and we're really looking forward to the new age that these physician's assistants bring on in supporting the practice and also our physicians that are at that location.
So Hillsdale Medical Associates, you have Dr. Baker, you have Dr. McCants, and you have new providers that we just brought on that we've talked about.
Correct.
Brandon has a long history here in Hillsdale County.
Yeah.
I think, he's ready to take patients when? 2 weeks, you said?
Yeah, so he'll be starting with us next Monday, and the Monday after that is when we'll have a soft launch with patients, and then by March, Brandon will be seeing patients.
So if I wanted to be seen by Brandon, could I call today?
Absolutely. We are taking patients on the schedule for Brandon Douglas.
Okay, so let's transition. So we have Hillsdale Medical Associates, once connected with independent practice, now under our ownership. We also employ Dr. Shaw.
Correct.
Dr. Shaw's location near downtown, so very convenient, and renovated that. It looks very nice, by the way.
Yeah.
It looks very nice. We had a chance to look at it Friday. But why don't you talk to us about what type of patients is Dr. Shaw seeing?
Sure. Dr. Shaw, traditional primary care family medicine standpoint, currently seeing patients Monday through Thursday, and works very closely with the other Hillsdale Medical Associates location.
Yeah. So working in collaboration with means what? If I call Hillsdale Medical Associates and they can't get me in, and I ask if Dr. Shaw can get me in, can they communicate that?
Yeah, there's synergies in that regard. And also, as we mentioned, the walk-in support as well.
Right. So should there be any reason as a patient that I cannot get in to see a primary care?
No. If there's an unavailable appointment with the provider you were connected with, we always have our walk-in clinic for backup.
Now let's talk. You've been in this industry and you've been dealing with primary care clinics longer than I have. So let's talk a little bit about when someone decides to leave an organization. You experience this at your big system, but people leave, right? For many reasons, Seth. And if they are not wanting to work in the system, we don't want them to work in the system. They need to go do whatever their passion is. Some may be influenced by family, others influenced by, they change their practice all together, right?
Correct.
They might say, I want to focus on this particular specific area. I may want to get into dermatology. I may want to get into respite care, whatever it is. And they leave us. It does not mean that we had a bad relationship. It just means that for whatever reasons, both parties, one is left. Some retire. It's very difficult for us in this community because Dr. Wachi was my primary care provider. We lost a valuable resource in this community, and it's becoming harder to recruit to rural America, correct?
It is.
And so talk a little bit about that.
Recruitment is a challenge. It is. And, first and foremost, we do want to have the right resources to support our patients and community. And so when there is a departure, the last thing we would ever want is that patients feel that their care departs from the organization, because that's not the case. Most times we're looking for an outright replacement for the skill set that has vacated a position. And oftentimes we look to enhance it further if possible. With that in mind, we do try to have people placed at the same location that they're at, but we have various other locations where a phone call literally will get you connected and reestablished in the event that there's a departure of your provider.
So Seth, are we engaging in telemedicine any longer? Are we doing the televisits? So let's say someone's at home and they're just can't get out. Is it still an option?
It is. And we have a bit of a variety with our approach to that. We just coincidentally had a meeting earlier this morning with the entire primary care provider team. Dr. Muse, our medical director, and myself spearheaded that meeting. And one of our APPs was talking in depth about her MyChart virtual encounters with her patients. And so for those of you who are not familiar, my chart is your patient chart that you have access to, whether it be on your phone or your desktop, for all of your appointments, your lab results, you name it, your notes, everything from your healthcare at the tips of your finger. And so we can also connect you virtually in that manner for visits that are appropriate. Of course, if there's something that requires, hands-on testing or anything like that, a virtual visit may not be appropriate. But your clinic can also describe to you your provider with any phone call. If you're questioning whether you're appropriate for a virtual visit, we will field that phone call and work through that with you.
I think it's an important point to hit, is to reduce the time that a patient has to wait on hold, and to reduce some of the overwhelming volume of calls that we're getting right now in the clinic. Patients can get their scripts refilled by going online to those particular areas and saying, I need a refill.
Correct.
And again, I would strongly encourage, they can actually access this by going to our website, Hillsdale Hospital. And then there's 2 links there. One's for my chart. The other one is hospital side versus the clinic side. I think it's a great opportunity for individuals just to do it from the convenience of their home. You can do it at 3 a.m, and that goes into an inbox, right?
Correct. For
who's managing that?
For the team members, the support staff, as well as your provider. They have visibility for your request that comes through. Sometimes that request can be answered with a response back through my chart. Other times it may be someone at the clinic picking up the phone to give you a call for additional information, clarification, etc.
Yeah, so good. So, all right, let's transition. A couple more clinics to talk about, then we'll get on our way here. So Hillsdale Health and Wellness seems to be a very busy place lately. Lots happening. We're seeing dozens and dozens of patients. I think one day last week, one of our providers saw nearly 40 in one day alone, just as one provider.
Yeah.
That's a lot of work. And so we have a lot of rock stars out there. I'd be remiss if I did not say we are very fortunate and blessed to have Dr. Muse, our new medical director, who is absolutely knocking out of the park. It's so encouraging to have someone who loves medicine, practicing that medicine, who's engaged in that medicine on a daily basis. But talk to us a little about HHW. How does it function? Is it just walk-in, primary care? What do we do about that? How have we covered some of those gaps with Boachi's loss, those type of things?
Yeah, very busy clinic, and multiple providers working there. So, the core of what we're doing at the clinic is primary care, family medicine, typical, Monday through Friday type of hours. And our walk-in clinic is that supplement to all of our practices for the access to care. And it just happens to be located at Hillsdale Health and Wellness. So we have Christina Old, nurse practitioner. She is our main walk-in provider, working dedicated exclusively to walk-in medicine. And then we have 3 other team members, advanced practice providers, that are practicing both primary care, family medicine, so your scheduled appointments, and they also support walk-in shifts and even work in walk-ins in between their scheduled family medicine appointments. Those providers are Jennifer Blond, Scott Hubinger, and Rihanna Pickering. Rihanna Pickering also has a certification for mental health treatment, where she's taking referrals as well, to help patients on an outpatient basis.
That's a big piece. I don't want to really just, gloss over it, because mental health services in our community, very difficult to find access. And so I know that it can be overwhelming at times because she has to balance both worlds. But if I want a consult with Rihanna for my 13-year-old son or daughter, I call HHW directly?
Yeah, we can start with a call to Hillsdale Health and Wellness, or if you're seeing a different primary care provider and you specifically have a mental health need, your primary care provider can also do a referral to Rihanna at Hillsdale Health and Wellness.
I'm so proud of our team at HHW. I'm proud of our entire team, but HHW, they're knocking out of the park. They're just absolutely serving the needs of our patients, same day appointments, getting patients in, and I get tremendous amount of positive feedback. And with anything, it gets busy, and things can happen.
Yeah, and as you mentioned, Dr. Muse, as our medical director, she's really hit the ground running, really taking things in a great direction, and she is seeing patients a couple days a week at Hillsdale Health and Wellness.
All right, so real quick, HMA, Hillsdale Medical Associates, HHW, Hillsdale Health and Wellness. Now let's talk a little bit about some of our other 2 practices that we have remaining. So one of the places that we have been for at least 20 years that I know, Reading Health Clinic. So we have a beautiful, we built it new facility down there, and we are busy. Talk to us a little bit about Reading. Who are we serving down there? What type of patients do we want to see?
Yeah, so we're serving our patients in that quadrant area of the community or of the county. I'm sorry, and of course we're open to anyone from anywhere coming in to see us. We even have patients traveling from Ohio, different areas such as that. We're closer to the tri-state area, at that clinic, so we do see sort of a trickle up effect, if you will, from those other areas. But we have Sherry Gillespie, nurse practitioner. That's our primary provider at that clinic full time.
Who is doing a tremendous job
Yeah.
at single-handedly handling some significant volumes.
Yes.
And she is actually not anyone new to the area because she was over in the Quincy area.
Correct.
Had a well-established practice working for a competitor of ours.
Correct.
But we were very fortunate to get her to come here. And I think the numbers have, Seth, just increased significantly, and access is much better.
Right.
So we're very, very happy with some of the output there.
And with Sherry at the helm at the clinic, the demand was high enough that we were also able to give some time to Dr. Muse, our medical director out at Reading Health Clinic as well. So you have Sherry rocking and rolling, Monday through Friday, and Dr. Muse has 2 additional days of coverage out there as well to help increase our patient access.
All right, one last clinic we need to talk about, and that is we have a presence for primary care out at our Three Meadows building, in which we're co-owners of that location. But talk to us about what primary care looks like. I don't think it's full-time all day, every day.
Right. Dr. Kirsch has a mixed time model for what he spends at the Three Meadows family practice location. He does also spend time at Hillsdale College with a relationship we have there with seeing, faculty and students there. But in the time that is split between that with family medicine at Three Meadows, Dr. Kirsch is working in new patients. Just spoke with him this morning at the meeting that I had mentioned. And he still has a pretty good proportion of new patients, which is a great thing. He's, continuing to build the panel, the reputation. Dr. Kirsch has a wide breadth of experience and is willing to take on a wide variety of patients, from birth to the elderly population. So it's a breath of fresh air to have that wide scope of practice and willingness to treat the community.
All right, so that comprises really our primary care practices. Dr. Kirsch also serves Hillsdale College. He is their provider. We provide services as the healthcare provider on campus, which is always an opportunity if you want to see Dr. Kirsch and you're part of the Hillsdale College family student. You can actually do that right there on campus, and you don't even have to travel to HHW or to Reading or to any other place. Use our clinic on the campus of Hillsdale College, only open to Hillsdale College staff and students. And so if you are listening today and you're part of the faculty or staff as well as a student, you don't have to travel. You can walk right over to right on your campus to the health clinic. So I want to bring that up. Seth, I think we've identified, the level of care that we can provide, which is full continuum. We are now, you oversee also specialty clinics. So I'm not going to talk about that today. That'll be a future episode. Okay. But, as we talk about this word internal medicine, and that becomes really a conversation about, no, I need to see an internal medicine provider. We provide that service here.
Correct.
And it can be done at different levels.
Correct.
So you want to talk a little bit about what is that?
Sure. The easiest way to think of our internal medicine, catch-all would be more of the higher acuity, more in-depth, type of visits that an individual would have. Basically, their medical complexities require a deeper dive, if you will, from their provider.
So it could be someone with like diabetes and chronic disease and those type of things.
Yeah, we can treat endocrine-related issues, diabetes, things of that nature. And, if anything were to be outside of our scope for some type of reason, we would make sure to liaison and network with the right type of referral services where we're keeping you, in your community here with us, receiving your treatment, and like I said, liaisoning with any other types of referrals and or partners.
Seth, it's great to have you on today. It's been rewarding to watch the clinics grow as successfully as they have. There's always growing pains. When we purchase a practice, and majority of these practices we have purchased. So when we purchase a practice, there's always growing pains. There's always times of frustration, but we appreciate the public and the patient's understanding because care is slowed down during these periods, but we're ramping back up. It slows down because we buy the practice and we have to switch them to our everything, electronics, EMR, phones, you name it. And that takes a while, which does delay at times and push back patient care. But we're on track now to move forward and full appointments. There should be no reason that a patient who was a patient at HMA should feel anything different anymore, even when your provider leaves, voluntarily leaves the organization. You still have access right here at home. Your record is safe here. The relationships you have with the office staff is still the same. Continue to use the services. We would strongly encourage you. But hats off to you, Dr. Muse, the team. Great opportunity to serve our community in this capacity. And then the return on that, obviously, is that once they are able to get in to be seen, is if they need testing, they follow up right here at Hillsdale Hospital. We're full continuum. If they need lab work done, some clinics, we do it in the lab. If they need x-ray, we do it in ortho, x-ray. We do it here at Hillsdale Hospital. Access points all over the entire county that we serve. So hats off to you. Thank you for what you do. And Dr. Muse and the team, we really appreciate it. If you're listening and you're part of that team, thank you. You do a tremendous job each and every day to make sure our patients can get in safely and making sure that it's on a time basis where it's convenient for them. It respects their timeline, their work schedule, all of those things. Thank you, team members at Hillsdale Hospital, for all you do to make this a great place for our patients to receive their care. So at this time, I'll ask, are there any questions online? None, Ms. Brown? No questions. That's great. You've answered them all.
Great.
That's perfect. Feel free, and remember, many of you watch this after the live. If you have a question, put it in the box. It will get to the right person. Usually, I answer every question that comes my way. And if you want to go connect with the CEO, that comes right to my email address. I answer those every day. You can get to connect with the CEO through our website, hillsdalehospital.com. You'll see a little icon, connect with the CEO. Also, if you have programs like this that you want to comment on, you can do that. It's monitored all the time, all day, every hour. Information will be provided back to you. Most likely, it's going to be direct to you. We're not going to post it for everyone to see. So please, if you have questions, comments, concerns, maybe you've had an issue where there's an access issue. I want to hear about it. We want to hear about it. Please let us know. If you have a positive comment, we want to hear about it. We want to pass that along to our community of providers. So thank you very much for joining us today. Seth, thank you for joining us. As always, you can connect with us, hillsdalehospital.com. We have these live events really to keep you informed about what is happening in healthcare right here in your community. If you want to nominate a staff member for Outstanding Award, Hero Award, Patient Care Award, Support Award, whatever it is, you want to contribute to our capital campaign, you want to be part of award-winning organization, go to our website, hillsdalehospital.com. You can see a tremendous amount of opportunities there to volunteer, to work here, to engage with providers, to access your portal. All that's available online. And so we would encourage you to do that. You can catch us live every week. And then WCSR 92.1 on Fridays. We talk about most of the things that we talk about in the studio. And then at 102.5, every Saturday, we're addressing the same issues that we're talking about on the radio. So until then, we ask that you stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us today.